I'm Jane Barr. We're from Newton Wellesley Hospital. We're from the Cardiovascular Center. I'm the Community Wellness Coordinator. I'm also a dietitian. And with me I have John Scherry. He's a physical therapist, and he's also the manager of our cardiac rehab department. And then I have Daniel Destin, who is an exercise physiology and works with a number of patients from our cardiovascular clinic. So this is the second part of a three-part series called Jumpstart Your Health. The first one was nutrition. I have a couple people who came to the nutrition, and now we're going to focus on exercise today. And then the third part in the series focuses on relaxation and stress reduction. So that was supposed to happen in May. We are going to have to switch that date around, unfortunately. So without further ado, I'm going to let John and Daniel get started. And this is an interactive session, so we're going to have you doing some stretches and have you get up and move around a little bit.
Great. Hi, everyone. How you guys doing? All right, so we'll get this started. Okay. So Jumpstart Your Healthy Life series, Jane just went through all that. All right, so this is the overview of the program we're going to talk about today. We're going to talk about the difference between aerobic exercise and physical activity, the why and how of strength training and why it's important and how you should do it. We're going to have a strengthening practice, which we'll go through together. I brought some bands here together, so we'll do an exercise program together. It'll be fun. It'll be interesting, okay? And then we're going to talk about stretching, and that's going to be John speaking about stretching. He has a nice little stretching program practice to do with you as well that he's going to go through. So what are the different types of exercises? So we'll start with aerobic. Aerobic exercise is planned, structured, repetitive body movements designed to get your heart rate up. I'm going to ask you guys, if somebody wants to volunteer, what's your favorite aerobic exercise? Anybody want to volunteer that?
Zumba.
Zumba is a great exercise, great dance, it's movement to get your heart rate up, and it's fun. Anyone else?
Walking.
Walking is another great one because it's a simple one and you can kind of modify it as you want, the intensity, how fast you go, do it inside, outside, on a treadmill, at an incline. So those are really good ones. Strength training is also important, right? So the importance of strength training, it improves your muscular endurance, your size, and helps you push load and resistance, okay? Anybody have a specific exercise they do for strengthening?
Water exercises.
Water exercises are great because you're pushing against the resistance of the water. Anything else?
Weights.
Weights, another really good one, right? So it's resistance exercise you could do with dumbbells or machines, another good one. Flexibility, which John is going to talk more about, helps improve the range of motion in the joints. John is going to speak about the importance of it, how we don't do it enough, and how you should be trying to do that on a regular basis after your workout. And then it's anaerobic exercise, which is more of a high intensity exercise, which is a short duration of getting your heart rate up for a prolonged amount of time and then coming back down. Usually we recommend that people do it from 30 seconds to a minute. It's a great way to get a workout. All right, so aerobic exercise prescription. When I prescribe exercises to my patients, I use the FIT principle, which is FIT. F stands for frequency, which we recommend 4 to 6 times a week, okay? And that's through the American Heart Association. Then there's the I, which is the intensity. It's how hard you're working. So what we tend to do is we use a subjective scale with our patients in cardiac rehab or at the fitness center. And we have them look at a scale of them, and we have them work from 11 to 14. It starts from 6 to 20. That's another one. Another clinical way to do it is taking a formula of 220 minus your age and working from 50 to 70% of that predicted heart range, okay? The easiest way to do it is, as you're walking, are you able to have a conversation with someone next to you? Or are you panting? Is it struggle? So if you're able to have a conversation and as you're walking, that's where you want to be from that 50 to 70% mark. So we call that the talk test. And that's a moderate way of exercising. The T stands for time. We recommend 30 to 60 minutes per session, 150 minutes to 300 minutes per week. So you start off with a minimum, 5-minute warm up. You could just walk in place. You want to cool down at the end of your workout. And ideally, you want to have this a continuous motion throughout the whole exercise, like if you're walking or on a bike or doing Zumba or anything like that, okay? So this is the scale I talked about. Again, using the clinical setting, we use these numbers because if you multiply by 10, that gives you about the heart rate that you're exercising at. So if I ask you on the scale, how do you feel? And you tell me I feel about an 11 on the scale, then your heart rate should be about 110 right there, okay? That usually correlates pretty well. Again, it's a moderate physical activity. You want to be able to have a conversation while you're doing the activity. Now, what's the difference between exercise and physical activity? As again, we spoke about aerobic exercise. It's planned and structured. It's designed to get the heart rate up. You want to do at least 30 minutes of that. You guys had mentioned some really good aerobic activities, such as walking, Zumba, getting out on a bike. And you want to maintain that moderate pace throughout the activity. Physical activity is a little different, right? I can get my patients to do aerobic exercise, 1 day a week, 5 days a week on a regular basis. But getting them to physical activity is different, right? So what we tend to do is we do our exercise program, then we sit down all day in front of a screen, watch TV in front of our computers. We don't get enough activity. So physical activity requires you to get out more, like count your steps. If you have an activity tracker, either on your wrist or on your phone, try to get your 5 to 10,000 steps a day. Try to be more active throughout the day. Sit less, move more, do activities like gardening, things around the house, cleaning around the house. That all adds up, helps you burn calories and stay fit. So this is your exercise plan for the week. You're going to put an exercise plan together for the week. It consists of the aerobic training. You want to do a 5-minute warm-up, which we'll do before we do our exercise here. 20, 30 minutes of your target heart rate range, like I mentioned before, which is that formula 220 minus your age, working between 50 and 70%. And then to cool down 4 to 6 times a week. The stretching that John is going to review with you guys, you want to hold each stretch for about 30 seconds. That's going to help improve the range of motion and the joints. And then the strength training, you only need about 2 times a week of that, targeting large muscle groups, and you can use any mode, and we'll talk about different modes in a second. So the benefits of strength training. You increase muscular strength and endurance, right? It helps you with your walking speed. The more muscle you have, the less effort you make during regular activities, right? So going up and down stairs, if you're stronger, that puts less load on your cardiovascular system, less load on your heart, making it easier for you to do activities. It improves your self-confidence, you feel stronger. There's balance. It helps with that as well. And then, for the body, when you add load to the body, you get a response, nervous system response, which tells your muscles it needs to be stronger. It tells your skeletal system to build up as well. So it can help with osteoporosis. And then this is a little joke about resistance training. This is the typical resistance training I usually run into with my patients. Now, resistance training guidelines, we're looking at frequency of 2 to 3 days a week. The intensity you should choose between 8 to 12 reps if you're able to, right, for the exercise. And, that's push and pulling. Volume, 2 to 4 sets of the 8 to 12. And then progression, you should try to progress the intensity either by increasing the load, making it a little heavier, the reps, the sets, or try to make things more challenging. You could do the same exercise, just balancing on one leg and making it more challenging, okay? And then you could see improvement there. And then allow yourself about 24 to 48 hours to try to recover in order to let the muscles grow and repair. These are types of resistance. Free weights, great for just going to the gym. The gym's usually loaded with that. You can have a set in the house if you wanted to. There's machine resistance as well when you go to the gym. This is great. It's a little safer than the free weights. It really keeps you, your alignment, safe. And then there's your body weight exercises that people do. Push-ups, squats, things of that nature. And then resistance bands, which we have here. And what I tell people to do is like, pick the exercise that works best for you. That's the best resistance training that you could do, is the one you enjoy the most. So we do not stop exercising because we grow old. We grow old because we stop exercising. So based on that, what I'm going to have you guys do, if you're able to, so I put a little exercise program together with you. We have bands over here, and we have 3 different resistance. We have green, blue, and red. All right. Red is the easiest one. Green is kind of a medium one, and then the blue is the most difficult resistance, but not too challenging. Okay. So I'm going to have you guys pick one. We're going to hand these out. All right, guys. I'm going to have, if you're able to, stand up. We're going to start with the 5-minute warm-up that I talked about. Okay. All right. So what I'm going to have you do is, if you have good balance, you could just do this without holding onto the chair. If you need assistance, you could just hold onto the chair. But I'm just going to have you march in place first to warm us up here. Okay. Good. So this is the idea, is to get the blood flowing. Good. And we're just going to do this for a few more seconds here. Good job. Here we go. 10, 9, 8, 7, 6, 5, 4, 3, 2, and 1. Okay, next, we're going to add a little bit more dynamic movement to it, okay? So we're going to get your feet apart, a little more than hip width apart. And I'm going to have you guys take your left arm, if you're able to, is reach across the opposite side of your body. And then opposite, and then we go to the other side. Go. And then keep going. And then we're going to do a little twist and reach. Good. Just warm up the spine, warm up the hips a little bit. A little movement. Great job. You go 5, 4, 3, 2, and 1. Great, guys. Okay, next. So we're nice warmed up. We're going to start off on the chair with the band exercises. I have a seat. So we're going to sit up nice and tall, feet flat on the floor. We'll start with some upper body exercises, okay? So we'll start by wrapping the band at least once or twice around the hands, okay? Standing up nice and tall. Keep the band right in front of your chest. We're gonna do every exercise 2 sets of 8 to 10 reps, so about 10 reps each, okay? And then what I'm gonna have you start with is opening it nice and wide across your chest, squeezing right here, and then right back to the middle, okay? Here we go again. Yep, slowly. So we're gonna do it. Open out. And then focus on breathing as well while you do this. So always focus on breathing. So you're gonna exhale as you pull the band apart, squeeze, and then back into the middle. So that's 3. Good, guys. 4. So working some shoulders. And then you try to squeeze your back muscles as much as possible and bring it in. 5, 6. Good. 7, 8, we have 2 to go, guys. You guys looking good. 9, and last one, 10. That was great. All right. All right. Yes.
So you breathe out when you're...
So I always recommend that you breathe out during the exertion part of the exercise, the hardest part when you're pulling, so you don't hold your breath, okay? And then inhale as you come in, the easier part, okay? Okay, next, we're gonna take that band, right? You're gonna take one foot, either foot, right foot, left foot, put it on the middle of the foot, right in the middle of the foot, right there. If you want to step out to make sure it's safe, you can. And what we're going to do is going to work the upper back. So you're standing up nice and tall, sitting up nice and tall, excuse me. And you're going to pull straight back, your elbows past your back, right? Squeezing. And then right back to the starting position, okay? So you're not rocking. Make sure you're not rocking, okay? So you're nice and tall and you're pulling. So breathe, exhale, inhale, right back down. Great. Good. Again, that upper body. Working the back, squeezing. As you pull the elbows back, looking good. So the elbows go right past your rib cage and right back. Good. Let's go 4 more. 4. Good. 3. You're going to pull 2. And last one. That's great, everyone. Good. Take a quick break. All right. So we're going to rest the upper body for a second. I like to do exercises in 3s. All right, so we're going to sit up nice and tall again. And this time, we're just going to take the right leg, okay? We're not doing the band. We're just going to extend the right knee and then right back in, okay? So we're going to repeat. So working the quad in front of the leg. Squeeze if you're able to, and then right back. Good. with a nice tall sitting posture. You're gonna exhale as you kick out, inhale back in. Looks good, everybody. Keep going. 4, 5, 6, 7, 8, 9. Now these are all exercises you could do at home. And 10. Good. Okay, now switching legs, okay? Same thing. We're gonna extend. Good. Working the muscles around that left knee. Good. We're breathing out. 2, 3. Keep going, guys. Good. 5. Let's go 5 more, guys. Keep going. If it's too much, you can just ease up a little bit. Here we go. Again, last 3. Good. And rest. Okay, so like I said, I want to do everything 2 sets of each exercise. So we're going to go back to the beginning. So again, nice and tall, holding the band in front of your chest. Bring the elbow straight back, squeeze the shoulder blades in the back, and then bring it right back to the center. So exhale, good, and back in. 2. Bring it back, and 3, 4. You guys looking good. Keep going. 5, 6, 7. Everybody okay? 8, 9, and wonderful. Great. Okay, one more time with the rows. These are rows. Here we go. Plant that foot right in the center, right in the middle of that band, nice and tall. Okay, and you're gonna pull your elbows past your back, your rib cage, and then back. Here we go. Squeeze. 1. Good. Get your workout in, guys. Good job. 3. You don't have to go fast with this, okay? Take your time. A little pause at the end, and then bring it right back. Good. Just like that. And don't forget the breathing. Good. 5 more. 5, 4, 3, 2, and 1. Good. And these are things you could do twice a week, guys. All right, excellent. Now that third exercise, I didn't forget it, okay? We're gonna do the leg extension to work that quad again, okay? The front of the leg. So again, great. Gonna help support the knee, keep it strong. Helps with balance too, guys. Keep going. 3, 4, 5, 6, 7, 8, 9. Excellent, guys. One more, other leg. Here we go. Ready? Good. And we're breathing. Sitting tall. Keep going. Extend. Here we go. Last 5, guys. You're doing great. Again, 4 more. 4, 3, 2, and 1. Excellent. Okay, so relax a little bit. Okay, we just got a couple more exercises here. Next, we're gonna work the back of the arm, the tricep, okay? So we'll take the band, wrap it once around the right arm, and the palms facing this way, like a fist facing out, just like that, all right? And down, thumb down, all right. Take the other one, wrap it, right? Keep it by your side, by your left hip, all right? And now from here, so left arm by your left hip, all right, and now we're gonna extend up just with the elbow and then back in slow. This is working the back of the arm, the tricep. Good, everyone looks good. You're doing a great job, keep going. 3, good. 4, 5, 6, good. Sitting nice and tall. Don't forget, posture is huge on this. Keep the stomach in nice and tight. Good, give me 2 more of these. Pull, and pull. Excellent, guys. Okay, we're gonna switch sides. So right hand by your right hip. Okay, left hand, thumb facing down, okay? And out and extend, just at the elbow. Good, just moving that left elbow, that's all, good. The flexion, extension of the elbow, that's tricep work, okay? Back of the arms, keeps it nice and strong. Keep going, guys. Good, here we go. Let's give me 5 more of those. And we're breathing. Yes, I see the breathing. Good job with that. Good. 2 more here. Reach and reach. Good. All right. Relax the arms a little bit. I know they're a little tired right now. All right, now, if you put the band around your back, that'd be great while you're sitting. Okay, we're gonna hold on to either end, to both ends. All right, you can do the standing or sitting. All right, but I'm gonna have you guys push forward with the arms. All right, and then back. Okay, so this is a chest press. All right, we're gonna extend forward and nice and tall. Try not to come forward, lean forward. You wanna stay nice and tall the whole time. Okay, nice. Push. Push. Good, and breathe. Exhale, good. So you can get a workout just in your chair, guys. Here we go, 5 more. 5, 4, 3, 2, and 1. Excellent, good. All right, guys. All right, the next, I'm gonna have you stand up. All right. We're gonna use the chair. If you don't mind getting behind the chair, so take your time, find your chair. Here we go. We're gonna do some squats, right? So we're working range of motion in the hips and the knees next, okay? If you're able to, right? Some of us, it's more of a challenge. Some of us can only go down to here. Some of us have deeper range of motion. What I wanna make sure is you have great support by the chair, and I want you to drive your hips back down. Like there's another chair behind you. You're trying to sit down, and then you're gonna come back up, okay, guys? Here we go. So we're gonna drive the hips back, and then come up. Good. Holding onto that chair and back up. Good, guys. Keep going. 3, good. Great form, everyone. Come down. Good. Give me 5 more just like that. 5, 4, 3, 2, and 1. Great. So I'm gonna make you guys work some more. We're gonna do this one more time. Have a seat. Have a seat. This is the last thing on a group of exercises, guys. You guys are doing fantastic. All right. Okay, we're gonna go back. I know the heart rate's going up, isn't it? Okay. We're gonna go back to our triceps. Is that I had triceps? Yes, here we go. Ready? And extend up and back. 1. Good. 2. Don't let me lose you guys. Keep with it, guys. Almost done. Good. Keep that strain on the muscle. We're working hard. You get to stretch after this. John's going to take you to a nice stretch, help you relax. And let's switch sides. Ready? And extend. 1, 2, 3, 4. Let's get your heart rate up, guys. 5, 6, 7, 8, 9. That is great, guys. Okay. Remember this last one. Okay. This right here. Put it around your back. What's our heart rate say for you? 85. Okay, good. All right, here we go. Right, remember this one? Put this right behind you. Here we go. Ready? And all right, we don't want to get that high. Push up. 1. Exhale. 2. If this is too much, you can dial it back, guys. 3, 4, 5, 6, 7, 8, 9, and 10. Take a quick break, relax your shoulders back, guys. Roll the shoulders back. Okay, drop your ear to one side, drop your ear to the other side, and we gotta do one last time with the squats, okay? So I'm gonna have you come up, and this is the last exercise you guys are gonna do. You guys have been great, keep working. Drop my mic, there we go. Okay, guys, we're going back to our squats. Ready, and go. Good, keep going. 2, 3, 4, 5, 6, 7, 8, 9, and 10. And you're done. Great job, everyone. Have a seat.
Question?
Yes.
What's the position of your back when you squat?
That's a great question.
I've been trying to keep my back straight.
Yeah.
Don't go anywhere.
Exactly. So you want to avoid rounding the spine, right? So you want to try to keep it as tall as possible. Sometimes when you have a lot of tightness in the hips, you're going to go forward a lot, okay? So if I could see your form, the idea is try to keep it nice and tall, nice and straight, and drive the hips back, and that'll keep your back flat.
You are going forward,
You are going a bit forward. You don't want to go parallel to the floor, but you are going forward a bit.
go like this.
That looks good. That looks good, yeah. Yep, you did great.
You do want to shift your weight forward because if you try to stay straight,
Yeah.
you're
Right.
going to lose your center of gravity.
Right, and you're going to draw it back, right.
So there's a little bit of a balance component to it.
Okay. Any questions? Okay. John.
All right. So my name's John. I'm gonna continue the discussion about stretching and the importance of stretching as a part of your exercise routine. Who in the class actually does stretch? All right. So we've got a good show of hands. I always say, at least with the population that I work with, it's probably one of the most overlooked aspects of exercise, right? A lot of people do cardio or aerobic exercise to get their heart rates up and work on endurance. A lot of people focus on strengthening, just like what Daniel showed you. But stretching is important for a lot of varieties, and we're going to go into that. So as I'm going through my slides, if you do have questions, don't be shy. You can raise your hand up, wave. I'll wave back, and I'll do my best to answer your questions. All right, so what is stretching? So stretching, it places parts of the body into a position that will lengthen or elongate the muscles, and then the other soft tissues that are around it. So with the muscles, the tendons, the ligaments, your skin stretches, right? We all see that pretty clearly. And if you have old scar tissue, and then fascia, that's like the layer of connective tissue between like the skin and the muscles, basically, so that all your soft tissues, they kind of glide over one another more easily. All right, and the benefits of stretching, of course, that helps us maintain a motion at a certain joint. It can help improve your balance and agility. So just looking back at the question about how do I do a squat properly, right? So, if you have that rounded back, that's going to affect your center of gravity and your balance in the long term. If you don't have that elongation, you might not be able to make a full reach, right? You just might be able to go part way up if you're reaching for a shelf. So we all have our different old injuries and impairments, but stretching can help with that. It reduces the risk of injury over time, so it prevents muscle strains. Individuals who have back pain often are found to have muscle tightness, so stretching can help with that. And it reduces the risk of falls. My exaggeration with that is we see some people who walk with a very short step length, and then there are some people who you see out there in the community with very long strides. And of course, those people who have shorter steps, that affects the speed in which they walk, and it does increase their risk of having a fall, unfortunately. And then stretches, they tend to feel good. They help after our decrease muscle soreness after our workout, all right? Which is why we're doing the stretches after you did the strengthening portion today. So why should we stretch? Again, we talked about maintaining a functional range of motion at a joint, right? You want to be able to move your arms or your legs as much as you can, right? We see some people who that's as far as the shoulder goes. And so we want to maintain that throughout our lifespan. And then it makes your muscles and joints and the soft tissue that we talked about in the previous slide more ready for action. So whether you are an athlete and you're playing in sports, whether you are doing yard work or housework, and just walking in your neighborhood, you need that flexibility to perform those daily tasks and activities. We mentioned earlier that stretching is a great way to prevent injuries. Again, it keeps the muscles long, they make them agile, they're flexible. If you watch sports on TV, you can see just how flexible those athletes are. It takes work, it takes practice for them. But if you think of, I don't know, since we're in baseball season now, you think of a shortstop diving for the ground ball, right? If they are not able to extend that arm out, if they don't have that range of motion, they're not going to make that play, right, or that catch. And while you might not be out there on the diamond playing baseball, for example, something falls off the table and you try to grab it, right, really quickly. You want to have that range of motion. You don't want to get a muscle strain or injure yourself. So again, stretching is going to be important to help prevent that injury. And when you do stretch, you don't want to put too much force on the muscle so that it stretches easily. We say stretches, they should be, you should feel a strong pull, but it should not hurt or be painful. Earlier we talked about how people with back pain tend to have tight muscles. And so stretching those muscles can help reduce that risk of having back pain. A lot of people with back pain, they either have tight quads or tight hamstrings. And all those muscles attach through the pelvis into the back and can cause back pain for us. And as I mentioned earlier about, like, I use baseball as the example, but the picture here with the tennis player, right? If you're going to serve the ball, right, you need to be able to reach overhead. Of course, we see some people who serve the ball underhand, and there's a reason for that, right? Because they don't have that flexibility. They need to address that or work on that. And overall, when we do stretch, like I said, it's a strong pull, but how do we all feel after we're done stretching? Yeah, you took the words right out of my mouth. We feel good, right? You're like, oh, that feels so much better. You feel elongated. You feel taller sometimes, and just the muscles thank you for it. So when you do stretch, what muscle groups should you focus on? All right, anybody want to share what they focus on when they stretch?
I focus on my legs.
So you're a leg stretcher, all right. Anybody else?
Knees.
Your knees, so that's also part of the legs. And we have a neck person, all right? So we're going kind of from head to toe or toe to head with the stretches. And you can see up here in the picture, right, there are a lot of muscle groups in our body. As you can see on the slide, there's over 600 muscles in the body. It would take us forever to stretch all 600 of those. So what people mentioned in the group, right, I stretch my knees, my legs, my neck. Those are large muscle groups. That's exactly what you want to focus on. All right, is those larger muscle groups. So when we go through the examples of stretches in a little bit, I'm going to target, again, large muscle groups from, I'll work my way from the feet up to our neck. So that way you can pick ones that either you realize that, oh, I need to have a little bit more work on that, or that's my limitation, I need to focus on that. Or maybe you just learned something new and you can add it to your repertoire if you're already a stretcher. All right, so what should you target when you begin a stretching program? All right, so this is the conversation we've just had. People shared within the group, right? Stretch those larger muscle groups. So you can see the pictures on the left there, the neck, the back, your trunk muscles, all right? Large muscles of the legs, all right? And then the shoulders and arms, that rounds out your body, all right? And you can be more specific, down to like fingers and things like that if you have a specific injury that you need to address. But the large muscle groups usually do the trick for us because that's what we use on a day-to-day basis. When is the best time to stretch? It is after, all right? So do your stretches after you've warmed up, all right? So we typically say, after you've completed your workout or you've done a warm-up of some type, because then you've increased the blood flow to those muscles, it's warmed the temperature of the muscle. It's going to make the stretching a lot easier for you. Think of a cold winter day when you get out of bed. If your house is cold, right? You're like, ooh, my body's really stiff. It's hard to move around, and maybe you might even feel some aches. It's harder to stretch with a cold muscle. All right. The old school of thought, people used to stretch before workouts, but the literature and research has actually shown that if you stretch before you exercise, it actually decreases your exercise performance. All right, so there is some science behind that part, but also stretching after your workout, like I said, when the muscles are warmed up, you're going to decrease the likelihood of encountering an injury as you stretch. All right, so if you just are doing a stretching routine, we tell people try to do a warm-up first, 5 to 10 minutes of walking or some kind of movement like what Daniel had everybody do in the class with like the marching and moving your arms around just to kind of get those large muscle groups moving, all right? And again, using the example of the waking up in the morning in a cold house during the winter, right? After you move around a little bit, you loosen up, right? Because you've moved around, you've warmed up those muscles. All right, so how to stretch. All right, I'll guide you through that in a little bit. But when you do stretch, the magic number up here, you can see is 30 seconds. All right, we all count 30 seconds in our head a lot faster than what the second hand moves on my watch. All right, so this is going to feel like a very long time to a lot of us. All right, sometimes I have patients in the clinic and I say, oh, count to 30. And then I'm looking over at them and I'm seeing 2, 4, 6, 8, 10, 20, 30, and they're done with their stretch, right? So I really want 30 seconds with all of you today. All right, you don't want to bounce in a stretch. So what does that mean? You know, and I'll maybe do the example of the person stretching in the photo, right? Where they're stretching their hamstring. When you reach for that muscle, I want you to lean into it, yes, but I don't want you to bounce or rock because that does these micro tears in the muscles or tendons. You can actually injure yourself by doing that, all right? So as you stretch, and if you feel that strong pull, of course, you know you're stretching, but then you can always add more or you can back off depending on what your body signals to you, all right? And when to stretch? So the American Heart Association, they recommend stretching at least 2 to 3 days per week. All right, so most of us do exercise 2 to 3 days per week or more, but adding that stretch at the end of your workout, again, is what's best when those muscles are warmed up. And your body will thank you for it, right? It'll prevent injuries, you'll feel better, you'll have improved balance and that improved range of motion. And then don't forget to do it after your workout. So when you do stretch, there is a cumulative effect from regular stretching, all right? So, you know, if you're somebody who stretches on a regular basis already, then you have that chronic buildup of building your flexibility, all right? If you're somebody who really hasn't stretched, you know, of course, yes, you're gonna improve your flexibility in this one sitting today, but it's just gonna be short-lived, all right? So if you do this 2 to 3 days per week per the recommendation, you actually will improve your range of motion. Now what they find in the literature is that when you stretch on a regular basis, you tend to tolerate the stretch better, all right, which is what allows you to reach better, all right, during the stretch. There are other stretches that you can do that are more dynamic or active, and then that changes some of our neural pathways to also improve the range of motion. But we're going to do, just for the example for today, we're going to do like static passive stretching, all right? But work towards, like we said, the recommendations of 2 to 3 times per week, and then keep up with that regular routine on a weekly basis so that you maintain that, or you can improve your range of motion. One of the examples I always share with the group is that when I was in physical therapy school, I participated in a study with some of my classmates about flexibility, and I was somebody who could not, you know, keep my legs straight and touch my toes. All right, I don't know if you want to say I failed in that study, but I've been a regular stretcher then since I was in my 20s, and I can now touch my toes without bending my knees. It takes work, it takes practice. So if you get frustrated during some of the stretches today, again, it's not going to happen overnight. Just it takes practice. Practice makes perfect. Can't say that enough. All right, so I'm going to sit in the chair and I'm going to guide everybody through some of the stretches. We are going to start from, like I said, I'll work from the feet all the way up to the head. And actually, since we're going to start with the feet, I'll have everybody stand rather than sit. So go ahead and you're going to stand behind your chair, please. We are going to start with our calf muscle. All right, so what you're going to do is you're going to extend your left foot backwards, all right? And make sure you get that heel onto the floor. You don't want your heel up in the air. All right, so make sure that that heel is on the floor. You can put a little bit more weight on your front leg. That front leg can be bent. And we're going to stand here for about 30 seconds. If you do not feel a stretch in the back of your leg, you can make a bigger step backwards. But you can see at this point, my heel's coming off the ground. So I'm actually overstretching. So I'm coming forward for myself to make it a good stretch. Everybody should be breathing as they're doing the stretch, no holding your breath, right? Otherwise, what happens when we hold our breath? It builds our blood pressure up, and when you finally come up for air, your blood pressure goes crashing down. That can make people lightheaded or dizzy. All right, go ahead and switch legs for me. So we're going to do the extend the right foot back. All right, get that toe back there. Put your heel on the ground, and you can lean into your forwards to feel that pull in the calf muscle. All right, I should not see anybody grimacing. If you're grimacing, that means it's painful. You're overdoing it. You can back off a little bit. Okay. The other thing that I recommend with this stretch as well, if you look down at your feet, they should look like you're either skiing or on a pair of railroad tracks. You should not have your foot out at an angle because you're not going to stretch your calf evenly. All right. All right, so that's 30 seconds on both sides. So now we can have a seat in our chair. And I'm just going to keep it interesting. We'll sit down, we'll stand up. That way everybody's blood circulates and nobody falls asleep in the class. All right, so for the next one, we're going to stretch our hamstrings. All right, and if you can't see me, you can stand up, of course. I'm trying to be in a good view for the camera for today. But you're going to extend your right foot first. Sit at the edge of your chair, extend your right foot. The knee should be straight, not bent. All right, so make sure that knee is straight. And you're going to reach for those toes. All right, again, if you can reach your toes, fantastic. If you can't, all right, just keep wishing and working on it, right? 2 to 3 times a week. All right, and we're going to hold that for 30 seconds. Remember to breathe. All right, if you feel any pain, whether it's in the back of the knee, whether it's in your back, low back, all right, back off on it. You don't need to hurt yourself. It's not a competition today. We are inspiring one another. All right. And that's about 30 seconds on that side. So you can switch feet. Extend your left leg for me. Sitting at the edge of the chair, make sure that that knee is straight, not bent, and reach for it. Because if you do bend your knee, you can pull your toe in. That gives you a little added stretch to the calf muscle.
That's what you get.
So I'm going to correct you a little bit on this. Let go for a second here. Straighten this knee for me. All right. And now keep that knee straight and reach. Do you feel the difference?
Yeah, I can't reach the toe.
It's okay. You don't have to reach the toe.
Yeah.
All right. But you're getting a good pull back here now. I can feel the knee as you're doing that. All right. So everybody's breathing, looking like they're having good form. All right, and then when you're ready, everybody can stand. Well, I'll do a demonstration standing up or sitting down, depending on your flexibility. All right, if you have good balance, if you have really good range of motion in your knee and you can bend your knee, you can do this one standing up. We see runners stretch like this. If you don't have great, it looked like this. All right, if you don't have great balance and you're not really able to stand on one leg, the safer way to do this is we can stay in the chair. And you can grab either your shoe or your ankle and pull on your knee this way. Okay, so everybody's going to do what's best for their bodies.
I can't pull my leg up that far.
Can you grab the back of your pant cuff and then pull your leg up that way? There you go.
As far as I go.
That's good. And the other thing is if you come forward, that'll allow the knee to come down and you can pull a little bit more. You feel the pull?
Yeah. Like I can't put my foot to my ass. My leg doesn't go that far.
Yeah. So it'll take practice.
I don't think I'll
Yeah.
reach it before I
Yeah.
die.
If you're having trouble doing it standing, sit down.
All right. And then we can switch sides. That was 30 seconds for that leg.
Let me look at the audience, see if anybody else is getting their ass.
And I'm going to do mine standing up actually for this one. And you said you felt it in your hip earlier? Was it a pain or so that can just be from overstretching, all right, and that you just don't have that flexibility of the muscle there. So a gentler stretch back off on it.
If I really stretch it, cramps up on me. You don't care.
And try to relax it. Yeah. Yeah, all right, and then everybody can relax. So there was a question up here, somebody mentioned that their leg was cramping. So cramping can be one of two things. Cramping can sometimes be an issue with dehydration, and hydration Drinking enough fluids will sometimes help with that, with electrolytes. The second thing that it could also be is if you do not have, if you're not fully relaxed with that muscle. Sometimes, you know, if I were to try to hold my muscle here using just the leg muscle, it's going to cramp up on me. All right, yeah. But if I can really turn that leg off, then that turns this muscle off and I'm not going to cramp. So sometimes it's a little bit of controlling your muscle groups. Okay, I'll have everybody sit back in the chair again. All right, so we've done calf muscles, we've done hamstrings, we've done our quads. So we've worked our way up the chain to the pelvis. All right, so the next one for the pelvis or hips, you're going to take one leg, just like we're sitting in the chair. We call it a figure 4 position. All right, and then what I'm basically doing is I'm taking my hand and I'm pushing that knee down towards the floor. All right, now if you have a hip replacement or you have hip precautions, yes, I'm going to ask that you please do not participate in this one unless your doctor's told you otherwise, because I would not like to have anybody dislocate any hips today. All right, and again, with this one, you can push down as forcefully as you'd like or as gently as you like. Some people are going to be more sensitive on one side than the other. And we do all have some asymmetries in our bodies, right? We might have a favorite side, we might have an old injury, or be stronger on one side. You might notice that you are more flexible on one side than the other. So go ahead and switch legs again and do your opposite by pushing down. All right, no grimacing again, right? I should see all smiles on your faces. Everybody should be happy stretchers. And again, as you've gone through most of these stretches, right, you'll say, oh, I'm pretty flexible with this one, or oh, I need some work on that one. So the one that you need more work on, you can maybe hold on to that, you know, and add that to your repertoire or routine. All right, next we're going to move into our low back. So again, assuming you don't have any spinal fusions or old back surgeries that prevent you from this, you're going to lock your feet between the legs of your chair. And I'm going to rotate over, I'm going to have everybody rotate over their left shoulders with me on this one. And I'm grabbing the armrest and the backrest of the chair and just twisting my spine to look over my shoulder. All right, now as you feel that stretch or twist, you might feel some clicks or pops in your back, and that's okay, as long as it's not painful. But what you can do to make the stretch a little more aggressive if you'd like is you take a deep breath in, and as you blow it out, try to rotate and twist just a little bit more into that chair. And you can repeat that with the breath if you'd like. But again, the idea of stretches is it should be relaxing and feel good. And when you're ready, you can rotate to the opposite direction, looking over that right shoulder. And don't forget that part of taking that nice deep breath in. And when you blow it out, you can rotate or twist just a little bit more. I'm glad everybody coordinated in the class and looked in the same direction rather than looking at your neighbor and giving them strange stares. All right, so we're going to stretch some of the upper body next. So we're going to just start with the shoulders. You can put your right hand forward like me, and you're going to cross that over your body and bring your other arm to pull that elbow into your chest. And you should feel this in the back of your shoulder, shoulder blade area. All right, you can squeeze your fingers, get some blood back in there, do the opposite arm, and pull that across your chest. Yeah, what's the question?
Things like my shoulder goes
So you may have, so some of the muscles, they call it like synergistic properties where like the muscles pull up or you have some tension or whatever. I mean, if you can relax and keep that shoulder down rather than shrugging it up. But compare yourself to your right side, right? That's the way that you know, am I balanced or am I imbalanced? But now it looks like you have the proper technique. All right, and then the last stretch we're going to do is for our necks. All right, so if you are somebody who uses a computer a lot or you sit at a desk, we tend to develop a lot of muscle tightness in our upper traps and the scalene muscles. So I'm actually going to turn my chair around so that everybody, and I'll stand actually so everybody can see. You're going to take your right hand, put it behind your back like me in your chair. You're going to take your left hand, you're going to grab your right ear, and you're going to pull that left ear to your left shoulder. All right, now as you do this, you can work in different angles with the neck. You can stay purely bent with the left ear to the left shoulder, or you can take your eyeballs and start pulling your neck down towards your left knee. And then what also makes a difference with this stretch is is your head kind of turned towards your right knee or is it turned towards your left knee? You will get different muscle fibers in the back of your neck as you rotate your head. So play around with that. Yeah, I see some people kind of wincing with their eyes, so you found your tight points in your neck. And you know, it's important to kind of play around with all those different angles. We do all sit a lot throughout the day, whether it's eating a meal, reading a book, watching TV. We are on our computers, unfortunately, or phones. All right, you can switch sides when you're ready. Put that left hand behind your back like me. Grab your left ear and pull the right ear to your shoulder. Try to keep that shoulder shrugged down. Don't let it come up, otherwise that defeats the purpose of the stretch. And then play around with those angles of the neck, right? Looking down at the right knee or turning your head and pulling it down towards the right knee so that you can feel the different muscle fibers stretch. And when you're ready, you can release the stretch. All right, so all the stretches were about 30 seconds. How did that feel to everybody? Did it feel like eternity?
Yes.
Yeah, 30 seconds is a long time, right? So do allow yourself, you can set timers on your phone so that you do the proper amount of time. There was a clock on the wall there if you didn't notice as we were doing the stretches. You can do it that way as well. Does anybody have questions about stretching or the strengthening portion that we did earlier?
Hands.
For stretches?
Yeah. Holding the phone or working on the computer.
Yeah, so simple stretches for that. Of course, you can hold your hand out in front. You can pull your hands this way, right? And you'll feel that in your forearm. So you can hold that for 30 seconds. You can do it on the opposite arm. The other thing that you can do as well, so this is really good, especially if you have, they call this like golfer's elbow. If you get tennis elbow, then you do it this way. And you pull the stretch and you can actually kind of rotate the hand a little bit so that you stretch those outside muscles by the edge of the elbow. And same thing, 30 seconds. But this is a smaller muscle group, so I wouldn't focus on that unless you have specific pains or restricted range of motion. All right. Jane, did you have other things to add?
Yeah. And I want to thank everybody for coming out today. We hope you enjoyed the class. You're free to take the bands with you so you can do these exercises at home. And Sydney has a handout of the stretches and the exercises we did today that she can email to you so you guys can continue to do them at home if you'd like.
Thank you.
Thank you.
Thank you.